Okay, I think we can get going. Brittany, we're good? Awesome. Okay. Hi, everybody. Welcome to our CERDHA Town Hall. Before we begin tonight's Town Hall, I would like to take this opportunity to acknowledge that we are presenting from the traditional territories of the Indigenous peoples of the Treaty 6 region and the Métis settlements and Métis Nation of Alberta, regions 2, 3, and 4. Additionally, the area that we call Alberta, where the college's registrants are located, is the traditional and ancestral territory of many peoples, presently subject to Treaties 6, 7, and 8, namely the Blackfoot Confederacy, the Cree, Dene, Saulteaux, Nakota, Sioux, Stoney Nakoda, and Tsuut'ina Nation, and the Métis people of Alberta. We acknowledge the many First Nations, Métis, and Inuit who have lived in and cared for these lands for generations. We are grateful for the traditional knowledge keepers and elders who are still with us today and those who have gone before us. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on or are visiting. So I'd like to introduce myself. My name's Amie Dowell. I'm the Registrar and CEO for the College of Registered Dental Hygienists of Alberta. We are very excited to be presenting tonight and so happy that you joined us. We have about a 45 to 60 minute presentation prepared, and then we have a question and answer period after. So during the presentation, feel free to submit your questions through the chat function throughout the presentation, and we will address all of them, or as many as we can, at the end. We've made sure that we have plenty of time to go through the questions tonight. So tonight's presentations will be for myself. I'll be speaking about the modernization of regulation, and then we're going to have Nicole Hannigan, one of our compliance advisors, present on practice standards. Marthe Benoit, another compliance advisor, she's going to be speaking on the role of the compliance advisor in the IPC standards. Salima Thawer, who's our Director of Regulatory Affairs, and she'll be speaking on continuing competence. Lloyd Fischer, who's our complaints director, and he'll be speaking about the complaints process. And finally, we have Brittany Hodges, our communications advisor, who will be speaking on the college's communications for 2022. Please remember that anyone watching this Town Hall tonight can claim one continuing competence credit, and instructions are on the registrant homepage of our website if you'd like to go there and find out how you do that. We'll also be sending out this recording for anyone who cannot attend the live event tonight. So if they watch it, they will also be able to claim one continuing competence credit. Again, thank you for joining us tonight, and please encourage your colleagues who cannot attend to watch the presentation on our YouTube channel. So we are going to begin by some quick slides on the modernization of regulation. So in Alberta, health, I'll just go to the next slide there. Perfect, thank you. In Alberta, health profession regulatory colleges, so such as the CRDHA, we're responsible for ensuring that regulated health professionals like dental hygienists, they provide services in a safe, competent, and ethical manner. The way that we do this as a college is by only registering those people who meet the requirements for registration. And then we maintain a general register of professionals where we provide practice permits every year to those that qualify. We set standards of practice and we maintain standards of education and training. And we hold dental hygiene professionals accountable to their practice through the complaints, investigation, and discipline processes. We also set and enforce standards of competence and conduct for the dental hygiene profession, and protect and limit the use of the registered dental hygienist title. This is a protected title that helps the public recognize qualified dental hygiene professionals who've demonstrated the requirements to practice safely. So when you think about regulation and what the college does, these are all the things that we do to try to protect the public and regulate the profession. So next slide. So what's changing? So you may have heard that there's big changes coming to regulation, that terminology around what is modernization, things are changing. So I'll give a bit of a background about changes to regulation, and then I'll get into some examples. So the Health Professions Act was proclaimed in 2001, and dental hygienists came under the HPA in 2006. And since that time, there really hasn't been any significant changes to regulations. It's been really stable. But recently, within the last couple of years, we've really started to see the modernization of regulation. It's not just occurring in Alberta, but really across the country. So some of these changes to regulations have been driven by the concern that the current model that we have is promoting the interests of the profession over the interests of the public. And a good example of this is in 2020, British Columbia received a report that was written by Harry Caton, who identified that there was a lack of public trust in regulators and a lack of focus on the safety of patients. And so these themes that he identified actually closely aligned with a previous finding from 2003 that was conducted by the Ombudsman in BC on the self-governance of health professions, and that report basically said the same thing. So right now we're seeing some really key changes across the country. In BC, you may have heard, but all the oral health regulators are amalgamating into one regulatory body. So that'll be the dental assistants, the dental hygienists, the dental technicians, dental therapists, dentists, and denturists. They're all their colleges are amalgamating right now into one college. So that's a really big change to regulation. In Ontario, they're having discussions with the other oral health professions and exploring amalgamation, but they haven't really landed on where they're going yet. And then in our province, we have Bill 46, which many of you may have heard of already, and this is the most extensive set of amendments to the Health Professions Act in 20 years. And the fourth major professional regulatory reform in the past 2 years for the colleges under the Health Professions Act. So we've been seeing quite a lot of changes occurring. So next slide. We're getting lots of questions about what does modernization mean, and I spoke about it in the last newsletter around we are starting to modernize, and so I wanted to give you a few examples about what that actually means. So one of the key changes of modernization is really how colleges govern their profession. So governance is how groups of people organize themselves to make decisions. It refers to the structures and the policies and the processes that are put in place to make the decisions about how to regulate a profession. So regulatory colleges in Alberta, they're governed by councils, and councils provide that strategic leadership and decision making for the profession. However, there have been concerns identified that the governance of colleges is not independent, and they lack a competency framework and a skills matrix and clear accountability processes to the public that they serve. So that's not just in Alberta, but just in general, governance has been under a critical lens. So because councils must provide effective leadership to ensure that colleges fulfill their legally defined mandate under the Health Professions Act, some of the key changes or modernizations to the governance are a few things. So here's a couple examples. So we're seeing that councils are now being moved to be made up of both regulated members of the profession, so in our case dental hygienists, and then also public members who are not registrants of the college. Public members are appointed by the government, by the Minister of Health, and they ensure that the public's perspective is considered in the governance of the profession. And in Alberta, one of the changes that we've had in the last couple of years is that we've moved from having 25% public members on our councils to 50%. So right now we actually have 50% registered dental hygienists and 50% public members. We don't have all of our public members yet. We're still waiting for some appointments from the government, but essentially we're moving to 50-50. Another issue in governance is the misconception that council members who were elected by the registrants actually are accountable to those who have elected them, rather than actually being accountable to the public they protect. So in order to address this misconception, councils are moving to fully appointed councils based on competencies and skills. So we actually made this change at the end of 2020, where we no longer do elections, but we have a fairly significant appointment process, and we've had tremendous success in appointing dental hygienists to our council who have a diverse background and the right mix of skills and experience to govern effectively. So we've made that change, and it's been very, very positive. Another modernization for governance is just improved and purposeful education. So we're investing in ongoing education, not only for those who are on council, but for our committees and our statutory committees as well. So really targeted governance education for those who are on council and committees. So those are examples of modernization of governance. Another example of modernization is the movement towards amalgamation. So I just spoke about that in the last slide. And in Alberta, we're actually going to see amalgamation enabling language that's going to be added to the revised Health Professions Act, but there's not going to be at this point any requirement to amalgamate. However, another modernization, it could also be a more collaboration between regulatory colleges. So not necessarily moving towards amalgamation, but actually more collaboration with the colleges. So a good example of how we're moving towards greater collaboration with the other colleges is our new IPC guidelines, which are almost ready for approval. So this is a collaboration between 4 oral health colleges, and it's been a 2-year project, and we're really looking forward to releasing those shortly. Most of you are familiar with this next example of modernization, and it's the separation of regulatory colleges and professional associations. We've discussed this modernization quite a bit, and it's been in a lot of our communications. But this is actually a really key update for the Health Professions Act. So the new language in the Health Professions Act will prevent colleges from acting or holding themselves as a professional association. Essentially, this means that any college that has a dual mandate, so the most pertinent example for us is the Alberta Dental Association and College. They actually have a dual mandate. They're required to formally separate, and there's a handful of other colleges that have the dual mandate that will be separating or have separated already. For colleges such as ourselves who did not hold a dual mandate but maintained certain association tasks like hosting an annual conference, we've had to completely divest ourselves of any of those duties that would traditionally be done by an association. And actually last week we submitted our formal divestment plan to the government for approval. So we've confirmed our divestment of those activities. A couple more examples would be transparency. So real huge push for transparency in our regulatory processes. So the Harry Caton report found that legislation can sometimes build secrecy into the complaints process and some of the other regulatory processes. And in doing so, it protects the registrant's privacy versus the protection of the public. So the need for increased transparency in our processes is a frequent theme for regulatory modernization, specifically around complaints and the need to disclose information regarding findings of complaints against professionals, including publishing actions taken to resolve the accepted complaints. So we're having some bylaw language changes right away, but traditionally we have not published complaint findings on our website, but in the spirit of transparency and modernization and the protection of the public, we will now be posting all of our complaint findings on our website. And finally, we're also seeing a greater trend in government oversight of regulation. So we're actually kind of moving away from this idea of self-regulation and into more of this idea of co-regulation, which means regulatory colleges have to become stronger partners with the government. So a really good example of this is the Fairness to Newcomers Office. This came into effect on March 2020, and it's a government authority that has the ability to ensure that qualified individuals entering a regulated profession don't face unfair regulatory processes or barriers. So we now work really closely with this office to streamline, simplify, and accelerate registration processes for newcomers. So as regulation continues to modernize and move towards co-regulation, we're going to expect to see a higher degree of government oversight in the regulatory processes, which is going to lead to greater accountability and transparency in regulation. So for my last slide, just some really quick examples of what we're doing as a college, and I've mentioned these already in my last slide. But essentially, we're really looking at all kinds of governance best practices and making changes to our governance processes to align with this modernization. We've divested ourselves of the association tasks and submitted our formal report. We're currently in the process of rewriting our bylaws, our practice standards, and our guidelines. We're on board, and it's actually one of our values is increased transparency. So you'll see more things on our website and in our communications around how we do things. So what is the registration process? What is the complaints process? What can you expect if you're registering with us versus on the other side and in complaints? We've really enhanced our communications, which Brittany will be talking about later on in this presentation. We're going to be looking at continuing competence best practices. So in the next couple of years, we'll most likely see some enhancements or changes of our continuing competence programs. And then, of course, improved technology infrastructure. And this is mostly driven by government reporting. There's a greater and greater need for more reporting to the government. So we need to make sure that we have the IT infrastructure to support that reporting. So that's just a really quick background on modernization. What can you be expecting from the college over the next year or so? And now we're going to dive into a few details. So I'm going to hand it over to Nicole, who's going to be speaking about our changes to our standards of practice.
Hi everyone, my name is Nicole Hannigan, and as Amie said, I'm one of the compliance advisors with the college. Tonight I'll be talking about the Standards of Practice project. So Brittany, you can move to the next slide. So as Amie mentioned, modernization of the college will involve rewriting many of our regulatory documents. In 2022, updates to the Standards of Practice will be a major focus of the college. There will be some required updates with Bill 46 that need to be captured in our new standards, but we'll also be taking this opportunity to significantly modernize the standards. We really want to talk to you about this tonight because a key benefit and responsibility of being a registrant in a self-regulated profession is that you get to be involved in this process. So I'd like to kind of start by briefly explaining how the standards of practice fit into the regulation of dental hygiene and ultimately each registrant's practice of dental hygiene. So at the top of this slide, you'll see the Health Professions Act. This piece of legislation delegates professional self-governance to the regulatory colleges like the CRDHA. This act also requires that colleges must establish, maintain, and enforce a code of ethics and standards of practice. Below that, you'll see the dental hygienist profession regulation. And among other things, this regulation describes the restricted activities that dental hygienists may be authorized to perform. And it also specifically states that registrants who perform restricted activities must do so in accordance with the standards of practice adopted by council. So these standards of practice are one way that the college holds members of the profession accountable for the services that they provide and ensures that Albertans are provided with safe, high-quality dental hygiene care. The standards establish criteria against which the practice of all dental hygienists will be measured by the public, clients, employers, and colleagues. Registrants must comply with standards, and failure to comply with the standard is unacceptable and may result in disciplinary action. So really, this is all to say that the standards of practice are really important documents that significantly influence the practice of dental hygiene in Alberta. So why modernize the standards of practice? Firstly, really to improve alignment with the college's mandate, vision, values, and strategic plan. These can all be found in more detail on our website, but essentially the college mandate is to ensure that Alberta dental hygienists have the knowledge, skills, attitude, and judgment to provide safe, effective, ethical, and beneficial oral health care services to the Alberta public. And this is central to all the work we do at the college. The next point on this slide is to really ensure that the standards are transparent, consistent, and fair. We also want to take the opportunity to make them more user-friendly, simplified when possible, clear, and easily understood. And really, this is for everyone's benefit. By making the standards easier to understand, it allows the public to better understand the standard of care to expect from a dental hygienist. And with this, it allows the standards to better support registrants in providing safe, quality oral care. The last reason, again, is to make the required changes with Bill 46, where some of the information from our regulations as dental hygienists will move into our standards of practice. So let's look at the types of changes you'll see. So the standards will be organized differently than our current practice standards. Expect to see many distinct standards that are no longer organized into the categories found in the current practice standards. You'll also notice that some content from our Code of Ethics will move into the standards of practice. The revised standards will also have a new format, so each individual standard will have a consistent user-friendly layout that will also link directly to other standards. And you will see a few new standards. Much of the content from the existing standards will move into a new format, but new standards will also be added and content will be revised. So to give a bit more of an idea what this might look like, there's a list of standards on this slide. This is not an all-inclusive list, but a general idea of how the new standards might be organized. And you can see they're kind of in an alphabetical order instead of into the categories that we're in, that are in the current practice standards. This project involved an extensive scan of other regulatory colleges and other things that are happening out there. What we found is that many regulators provide a section in each standard that describes what the public can expect from each standard. As you've heard already today, public trust, accountability, and transparency are key components of modernization, and this will be reflected in the revised standards. So this slide describes some of what you can expect to see in the new standards. So there's three sections. The first one is the standard statement. So this is, the overall description of the legal and professional expected level of performance by a registrant. The next section is outcome expectations, which describe the outcomes that the public, employers, and team members can expect when a dental hygienist meets the standard. And the last section is the performance expectations or indicators, which outline the actions that must be demonstrated by the registrant to indicate how the standard is met in practice. To give a bit more of an example of this, because the outcome expectations are a new feature, here's an example from another college in Alberta. So this is the physiotherapist's evidence-informed practice standard. As you can see, the expected outcome, which is down below, explains the why of the standards and centers it on what the public can expect. So the standard statement in this example is that the physiotherapist incorporates evidence-informed practice in all aspects of physiotherapy service delivery. The expected outcome, which is then framed around what the client can expect, is clients can expect that physiotherapy services they receive are informed by consideration of the best available evidence, client needs, and the personal knowledge and experience of the physiotherapist. So development and revision of standards of practice involves a consultation process before they're approved by council. What this means is that you'll be provided with a copy of the standards to review and provide comments on before they're approved. Your feedback will be carefully reviewed to ensure that the college meets the goals of the project. So this includes feedback on ensuring alignment with the college mandate, along with feedback on how user-friendly, clear, and consistent the standards are. Expect communication in the spring of 2022, requesting feedback on the new standards. A section of our website will also be dedicated to updates on the project, and you'll find it in the section of the website titled Protecting the Public. I really look forward to the feedback and input that you will provide. With that, I'll hand the presentation over to Marthe, who will speak about the role of the compliance advisors at the college.
Well, hello, everybody. First of all, I'd like to say thank you to everybody who has been able to join us here tonight and allowing me to take a few minutes of your time to introduce you to myself and a little bit of what I do here at the CRDHA. So I am one of the compliance advisors at CRDHA, like Nicole. I'm a little bit, my role right now primarily consists of liaising with the public, assisting the public, registrants in understanding the regulation of dental hygiene profession, including the Health Professions Act and other legislation, including the Dental Hygiene Profession Regulation, CRDHA bylaws, standards of practice, code of ethics, and other guidelines and policies. So that's a big part of what I do. And so when I break it down, kind of my day-to-day might consist of, responding to emails and phone calls, which come in pretty frequently and regularly from both members of the public, other professionals, and of course dental hygiene professionals. So these questions can honestly vary from scope of practice question, legislation, from registrants right through to registrants who are interested in opening dental hygiene practices, and honestly everything in between that. I also provide support to internal programs and projects, including Continuing Competence program and infection, and we'll talk a little bit more about this, but the infection prevention and control guidance document. So if we move on to what my some of these compliance questions and what they might look like, there's a just a little list here of typical questions that might come into the to the CRDHA on a daily or regular basis. Now I'm not going to go through these and answer any of these right now, but this is primarily an example of what we might get. So can I treat a client if the dentist is not present in the practice? Can I treat clients using laser technology? What courses can I take? Do I need to display my practice permit? Can I administer a rest-in to my clients? This last one I'm going to spend a couple of minutes on because it is an interesting one, and we do get questions like this coming in on occasion. So, my client has presented with elevated blood pressure, 150/95. Can I proceed with treatment? So when we get registrants calling in with really specific clinical questions, we cannot answer those in the sense that you would like us to
Brittany, I think she might have dropped off. Oh, there she is. Marthe, you froze.
Oh, did I freeze?
Yeah.
Oh no. Should I go back?
So you said, what we heard was we cannot answer those questions, but.
Should we leave it at that? We cannot answer those questions. However, we can probably direct you to some appropriate resources that you can use in order to treat that client. So we can pop off to the next slide, and we're going to talk a little bit about sort of the second part of what I do with the CRDHA, and that is to assist on some of these bigger projects. So one of the projects that I worked on more recently is the Infection Prevention and Control Guideline Project. And so this is actually a really excellent example of what Amie had mentioned earlier. Sorry about that. I don't know if anybody else is getting that on their phone. There's some kind of an emergency alert. So a good example of collaboration, like Amie had mentioned earlier, with the modernization of regulation. And so it does include, you know, these collaborative projects with other colleges on mutually beneficial documents. So this one, again, is a really good example of that. So this next slide we're going to look at is really just sort of a timeline. So it'll help registrants understand, I think, what these collaborations look like, and really actually the time involved from sort of beginning to end. So if we look at this project, we started sort of, well, we know historically in 2010, you know, the CRDHA had adopted the Alberta Dental Association and College Infection and Prevention and Control Standards for risk management in dentistry. And of course, we did adopt that, and we used that document to refer to for infection prevention and control purposes. So somewhere roughly 2018, the CRDHA identified the need for a more current document that would address some of the practice areas specific to the practice of dental hygiene. During that time, we had begun to engage other colleges in these early discussions with the other oral health regulators on developing a joint IPC document to be used by all practicing oral health care providers in Alberta across settings. So 4 of the oral health care regulators in Alberta joined the IPC project. This committee came together. We worked quite a bit with subject matter experts, both from within each of the professions and also with external subject matter experts. We developed the draft guide document, which was circulated to you, the registrants, where you had the ability to provide some feedback. At that point, we are now presently integrating that registrant feedback into the draft document, in which case it'll go for final review and approval by council. So these projects, and I hope by sharing this sort of timeline, you get a better idea of the complexity and the time needed to successfully complete some of these really bigger projects. With that, I'm going to conclude and wrap up a little bit, but I'd like to thank everybody and for allowing me to share some of what I do here at the CRDHA. And in conclusion, just to mention that, you know, we're happy to take these questions from registrants. It's important and helpful if we have this interaction with registrants and of course the public and other stakeholders, but happy to have these interactions so we can help really explain the legislation and how it applies to practice. And with that, I will pass it over to Salima for her portion on continuing competence.
Sorry, I think I'm just unmuted. So my name's Salima Thawer. I'm the Director of Regulatory Affairs at the college. And as Marthe mentioned, I'll be talking to you a little bit about our continuing competence and some reminders around the expectations. So we'll just go to the next slide. So as many of you are aware, all dental hygienists in Alberta are required by law. So it's in our regulations that you are required to complete a minimum of 45 continuing education credits and 600 practice hours within your designated 3-year reporting period. So there's just a little picture there of the section from the regulations to share that with you. And on the next slide, I just wanted to go over reporting periods. So if your your designated reporting period starts on November 1st of the first year of your reporting period and ends on October 31st of the 3rd year. So if your reporting period or cycle is 2019 to 2022, then your reporting period starts November 1st of 2019 and it ends on October 31st of 2022. And then you can see the other reporting periods that we currently have in effect and when they start and when they end. So some registrants make the mistake of thinking that it starts in that calendar year, but that's not the case because our permit years begin on November 1st. So just wanted to make sure there was some clarity around that. On the next slide. So what I'd like to do really is share a definition of continuing competence with you, because as we got closer to renewal, we noticed there was quite a push from some registrants to complete those 45 CE credit requirements in particular, and some people were quite indeed down to the wire, really just trying to get right to that 45 mark. But this defeats the spirit and the intent of continuing competence. So I'm just going to read this definition to you first. So it states, continuing competence is the ongoing commitment of a health professional to integrate and apply the knowledge, skills, and judgment with the attitudes, values, and beliefs required to practice safely, effectively, and ethically in a designated role and setting. So there's a lot of words here that you hear a lot of the time, such as knowledge, skills, judgment, attitudes, values, and beliefs, and safely, effectively, and ethically. But some of the other words I want to bring to your attention that are really important are also the terminology around ongoing commitment, the wording around integrate and apply, and at the end there it states designated role and setting. And so I'll discuss those a little further in the next few slides. So we'll just go to the next slide. Great. So what does continuing competence look like? Well, it's going to be quite different for everybody. So if you are an early career practitioner, for example, and you've just graduated, you're starting out, it would be quite appropriate for you to take courses that are related to developing an increased proficiency of your clinical knowledge and skills. So if you're taking courses around instrumentation, that would be something that we would expect to see. If you're a more experienced practitioner and you've been in the profession for many years, it would not be appropriate to focus on those kinds of basic skills. So taking continuing competence, taking a learning activity on how to name your tooth surfaces would not be something that we would expect an experienced practitioner to take. It would be expected that you might that you would not be practicing the same way today as you might have when you started 15 or 20 years ago, for example. So you should be looking at courses that allow you to potentially adapt to new technologies, to incorporate new evidence-based practice. You might want to take some courses around privacy legislation or occupational health and safety legislation that has changed over time, or the infection prevention and control practices, for example. So making sure that you're staying on top of things, even though you've been practicing for quite some time, because practice is going to look different over time. We also would want to take into account different practice environments. So you might work in different spaces, such as a pedo office or a perio office. You might be working in a lower socioeconomic status neighborhood. Maybe you work in community health. And so you should consider activities and learning that are actually relevant to those particular practice environments. And lastly, we know that there's varied roles of the dental hygienist. So you may be working as an educator or an administrator or in a corporate role, for example. And so if you're not in a clinical role, then you would demonstrate activities that are relevant to the role that you are in. And so based on these factors, and probably many more in your own circumstance, it would not be expected at all that any two hygienists would have the same continuing competence profiles at any given time. Go to the next slide. So what are the responsibilities of a professional? So the first thing you really want to do is look at a self-assessment of your learning needs. And you can use our self-assessment tool that's available on our website to help identify relevant learning areas. You actually can also get 2 CE credits for doing that tool. So you can do it once a year for 2 CE credits. So that's a bonus. And then once you've identified your learning needs, you want to plan your learning over your 3-year continuing competence period to meet those identified needs. So this is the part where it's not just about checking the boxes to complete your 45 CE minimum. It's sometimes addressing your learning in an area might actually require more than 45 CE credits to accomplish. So that 45 is actually a minimum, and we would encourage you to take what you need beyond that if that suits the needs that you've identified for your learning. Just a reminder also that your CE credits cannot be rolled over into the next reporting period. So when your reporting period ends on October 31st, anything that you've taken up to that point stays within that reporting period. However, the spirit of continuing competence, again, is not about meeting the quantity required, but also the quality of your learning. Also, another reminder to not leave it all to the end of that 3-year period. Your renewal is contingent on meeting that requirement, but if you try to do at least 15 a year, then you're not scrambling at the end. We've also seen registrants who tried to claim more than 25 hours worth of CE within a single day. So just a reminder, that's not physically possible. You do need to report the actual date that you completed the learning, and you should be reporting hour for hour of actual time spent. So you may get a certificate where the CE provider recommends that it's worth 2 continuing competence credits, but if you only spent an hour or half an hour on that, then that is what you're expected to report. And lastly on this slide is you should be selecting relevant learning activities, as I spoke about previously, so courses that are applicable to your practice, your experience, your setting. And on the next slide, at the end of the day, once you've taken your learning activities, of course, the expectation is that you are applying that learning to your practice and that you're using that to improve the client and community health outcomes, which is the ultimate goal of what we'd like to see health professionals do. And while you're doing all of that, you are upholding the code of ethics and the standards of practice that are expected of all dental hygienists in the province. So yeah, just wanted to share that with you in terms of what the expectations are around continuing competence. As Amie mentioned earlier, we're expecting over the next few years, we'll probably look at revising the continuing competence program and rules. So you may see some more elements of accountability around these items. So we'd encourage you very much to ensure that you are embracing the spirit of continuing competence as you move forward. And with that, I'm going to pass it over to Lloyd Fischer to speak to you about the complaints process and professional conduct.
Thanks very much, Salima, and good evening, everyone. My name is Lloyd Fischer, and I have the great pleasure of being your complaints director at CRDHA. I thought I would just give an overview of what's going on in complaints, and I always thought it would be good to start with a reminder that I'm truly not a big scary monster. As you can imagine, most people are not pleased to get a call from myself as a complaints director, but I do really try to take a personalized, proactive approach when it comes to complaints, and I really look to work with our registrants towards a solution and really work effectively together through complaints. And so I'm going to provide you an overview of what's going on in complaints, some common trends, and hopefully some tips to keep in mind as you continue to navigate the waters. The first thing I do, in case complaints happens to be new to you, is just explain the complaints process at a really high overarching level. So when a complaint comes into the college, it does come directly to me, and under the Health Professions Act, there's a strict requirement of guidelines for the complaint to be validated. And so once I go through that and make that determination, there's then really 4 main options that can happen. One is informal resolution, which I'll get to and really is our preferred method. The other is to refer the complaint to a formalized resolution process. The other option, which you may be familiar with more when you think about context of complaints, is beginning an investigation. And the fourth option is to dismiss a complaint if I find it trivial or incomplete or insufficient in terms of evidence. So starting with that informal resolution, the idea would be that we would work collaboratively with you to address the issue or concerns. Of course, what we're looking at CRDHA in terms of public complaints is always around public safety. So we can get complaints on a variety of things from a variety of people. It can come from your coworkers, your colleagues, from members of the public, people you've treated, their family members. It can come from insurers, it can come from the government or other regulated healthcare professionals as well. So keep that in mind. Informal resolution is always our priority to look at. I want everyone to hear that. The college is not here to fight against you. It's not us versus you. There are some unique circumstances where certainly we couldn't do informal resolution. As an example, any Bill 21 complaints. But more often than not, we really do try to take a really human approach to complaints, that not everyone is perfect. And really what we're looking at is bettering the profession and protecting the public. When something does get revolved or gets reviewed and sent to an investigation, that process can be quite lengthy and also costly. This is where we would assign a third-party investigator. It could be myself or an alternate investigator to come out and do an actual investigation. This can include a site visit to your clinic. This could be reviewing notes or charts. This could be interviewing your staff, yourself. This could be interviewing patients. It could be also getting a subject matter expert to review case notes and the care plan that you've provided and is documented. It could be reviewing detailed billing information or insurance information. A wide variety of things can happen under the investigative lens. And then, of course, if the complaint is trivial or there isn't sufficient evidence, then certainly we have an option to dismiss. If it does go to investigation and we do find that there's wrongdoing, there is a formalized hearing process, and I'm not going to get too in-depth in that, but essentially, if you're familiar with sort of the court system, think of the Judge Judy or the people courts of the world, we would plead our case, you would plead your case, and we would make a recommendation on penalty, and then an independent third-party body, which is the hearing tribunal, which is a mixture of current regulated members in this profession and members of the public appointed by the Alberta government, would then review the case with their independent legal counsel and make a decision as to the determination of guilt or not. So I thought I would just go over a few current complaint trends that we're seeing at CRDHA. One that we're seeing really emerging, and I'm doing a lot of work with Nicole and Marthe around, is advertising concerns. So this would be things like you using before or after pictures, testimonials on websites or social media, and unclear pricing. It's really important when you're going to advertise. If you are a new clinic and you're opening up your own practice, a practice owner, or you're working collaboration with someone else, that you really take the time to read the college's rules around advertising and ensuring that you're being compliant. I would always rather a phone call and someone being proactive to say, hey, Lloyd, what's going on with this situation, or can you walk me through this, as opposed to us having to pick up the phone and call you. Marthe and Nicole are great resources for this, and I also love volunteering them for this, but also I don't mind working with you as well. So please reach out to the college if you have any questions regarding advertising. On that will also be about social media. And so social media is a new and emerging trend. It's certainly not new in terms of being around, but in how we use it to communicate and advertise health-related services. And so there are strict requirements around social media advertising as well, so ensure that you're aware and up to date on that. Fraudulent billing, unfortunately, we have seen a trend here in Alberta. This would include things like double billing for services, billing wrong codes for services performed as well. Keep in mind that insurers do have a process where they audit claims in the background without your knowledge and will alert a governing body such as ours if they see a trend or information that they are unsure of. We have seen an upswing in this quite recently compared to year over year in the past years specific to fraudulent billing. And so I would just encourage you all to really take the time, either yourselves or whoever you get to do the billing, to really ensure that they're following those requirements in terms of what the insurer has in the fee guides, and that you are billing only for services that are actually performed. Another area of complaints that we have had to tackle this past year is around COVID-19 guidelines. It is important to remember as a regulated healthcare professional that you must follow all provincial and college directives in terms of COVID-19. There is a lot of conversation happening out there in the world, and your personal values aside, it is important as your work as a regulated healthcare professional that you do in fact follow all provincial and college directives. Making a statement like, I don't agree with that, I'm not in alignment with that, is not appropriate. And so we've seen quite a lot of complaints, unfortunately, around that. Also around spreading misinformation to patients or the public, and this would be where you take your personal values and you mix it with the professional line. It's important, again, as a regulated healthcare professional, that when you're providing care to a member of the public, that you follow all provincial and college directives. And so sharing misinformation that you may have read on Facebook, or something your cousin told you, or something you saw on TV is not sufficient. Keep in mind your scope of practice and what you are authorized to speak to in terms of a medical capacity. Finally, just general unprofessional conduct. These kind of blend together with the 3 points above, but it's important to remember the way in which you interact with the college through phone calls, through emails, or references that you make on social media platforms can be an issue. And so I just remind everybody that I understand we live in a frustrating world. Sometimes use of technology, whether it be our registration system or just general processes on our website, could be frustrating to you. Keep in mind that it is technology and things happen, and so we're here to work with you and support you. When you're being told something, whether that be from Salima or Amie or our practice advisors or myself, it's not our personal opinion or how we feel about the situation, it's interpretation of law. And so it's really important to just be aware of that and monitor how you're engaging with the college. If you're raising your voice, if you're screaming, if you're swearing, if you're hanging up on us, if you're saying rude or defaming comments on social media, keep in mind that that could unfortunately come back as a complaint. I'm sure everyone is aware of this and we're not going to have issues in 2022, but I thought I would provide it as a reference. Additionally, I just want to quickly mention failure to report other registrants. So if you are aware of something that is in violation of our code of ethics or our standards of practice, it is your legal and ethical obligation to report that person to the appropriate governing body. And so if you see a colleague that is doing something that they shouldn't, you need to call the college and file that complaint. Keep in mind, if we find out or we're aware of a situation and we do an investigation and find out that you did have knowledge or firsthand experience and did not disclose that, it can become a professional conduct issue for you. So again, we just share this information just to keep everybody really educated and alert to what's out there. And again, I'm always open to a telephone call if you want to talk through a situation before anything becomes a formal complaint. So how can I avoid a complaint? I get this quite often. And so really and truly, there is no sure way to avoid a complaint. Members of the public, insurers, or other regulated healthcare professionals, and your peers can all submit complaints to the college for review and consideration. But there are a few things you can do to better prepare yourself to either avoid complaints or to better prepare yourself in defending yourself if a complaint comes forward. One of the points is to be proactive. We want you to work with the patient to understand their concerns. Last year, over 50% of the complaints that were filed are patients who just truly felt that they have not been heard by their registered dental hygienist. So take that moment in that situation to really give a listen to them. Maybe it's a day or two after when they call the clinic or they pop back in to talk with you. Giving them that audience may avoid a complaint and really help better understand what they're upset about. Also, around documentation, my suggestion is to document everything. So the more detailed clinical notes, the better. If a complaint does in fact go to investigation, we will ask for a complete copy of all notes and the charts. This gets entered into evidence. It's important for you to make sure that you accurately and honestly depict what is happening. So more information is better than less information. And finally, really be truly transparent and upfront in terms of costs. So I tell new practice owners all the time, or people who work in a dental office with a dentist, do not rely on the front desk staff to take care of it. I understand that more often than not, there are other people who are doing that part or service, but you have an obligation to ensure that the patients you're working with understand and agree to the cost before treatment. So if you'd be in a dentist's office, sitting down with a dentist to better understand how you can be compliant with this would be a suggestion. We really want to make sure, again, we're being fair and transparent and that we're having that conversation with clients. I think that is it for me. And so with that, I'm going to pass that over to Brittany, our communications advisor.
Thanks, Lloyd, and thanks to all the other presenters, and thanks to everyone for being here with us tonight and staying on. I am the last presentation, and we'll get to questions when I wrap up here. So I'm just going to chat a little bit about what we're going to be communicating about this year, how we'll be communicating with all of you, and why that is important. So most of you are probably quite familiar with the emails that we send you. This is the #1 way that we communicate with all the registered dental hygienists. So please open your emails, because very likely the email is very important and there's really pertinent information you need to know in there. We regularly send emails. Those will be coming from Constant Contact, but they'll show up as coming from info@crdha.ca. So if you're not getting those emails, let us know. If they're showing up in your spam, make sure you add that email address to your Safe Senders list. We also send the regular quarterly e-newsletter in addition to the regular emails we send. When we send those emails out, we try to update the website as consistently as possible and make sure when you log into the registrant side, which is crdha.ca/registrants, you'll get all the information on there as well if you missed the email. We do also have some regular updates to our blog, which is on the homepage of our website, and that's typically more information for the public, and we'll post that on our Facebook page as well. If you're not part of the private registrants Facebook group, you can check that out as well. And we'll be sending out links after this town hall, and I'll make sure to include the link to both our Facebook page and that private group. And that's where you can ask us questions, interact with the compliance advisors, and we post updates in there as well. And then events like this. So regular town halls, we had quite a few during renewal last year, and we're planning to do more throughout 2022, and the town hall like tonight. So a lot of my colleagues touched on what we're going to be communicating about throughout 2022. COVID-19 continues to go on, and we'll be sending updates if there's changes to restrictions, PPE, things like that. Updates from our president and registrar, any other news and announcements. So when the IPC guidelines are finalized, we'll be sending those out. And of course, the standards of practice consultation. You can expect quite a few emails throughout 2022, as we really hope registrants are engaged throughout that entire process. And as I mentioned, renewal, there's always a lot of information to know about that, and it's important to make sure you're prepared for renewal and not leaving it till the last minute. So check those emails and make sure you know what all the deadlines are, how many continuing competence credits you need to have, everything like that. And then, so on top of what we're going to be communicating about, as Lloyd mentioned, as Amie mentioned, we are moving towards having more transparency and accountability with the college, especially with that complaints process. So once those bylaw changes go ahead, there will be changes on our website to how much we're going to be reporting about the complaints process and outcomes of complaints that come in. We are working towards having our emails go out to registrants a lot more consistently, so you can expect to have an email come from us every couple of weeks or so throughout the year. We are working really hard on updating the website. There's really great information on our website, especially on the registrant side that you log into, but we know it is sometimes difficult to find certain information that you're looking for. So we've taken a look at how we can make that information a lot easier to find and more intuitive. And with the standards of practice consultation and events like this, we are trying to get more engagement from registrants and hear from you and make sure that it's not just the college talking to you all the time, but we're also listening back. So with that, I think we'll take it back to Amie, and she has a quick conclusion, and then we will move to our question period.
Okay, so thank you to everybody who presented tonight. That was really great. We're obviously undergoing a lot of change in 2022, and in the spirit of transparency, we will be continually communicating this change and how you can be involved as a registrant. We hope that through this presentation you have a better understanding of regulation and how it's being modernized. We're really hopeful that you'll be engaged in the consultation process for the standards of practice throughout the year. And like Marthe had said, we are here to connect with you, and it's always better to proactively connect with us, especially with our compliance advisors and with Lloyd, with any of your questions about regulation. We're always open to emails, and always please open and read your emails from the college, because it's important that you stay up to date with all of the changes, especially over the next year or two. So we are now going to take a few minutes and address some of the questions that we received through email, and then we'll move on to any of your questions that were submitted tonight. Please use the chat function. When you type it in, you're not going to see it, but we'll see it on our side, and then we can publish your questions and answer them. So we'll go to the next slide, and this question is around COVID-19. We're still getting quite a few questions about COVID-19, so I'm going to pass this along to Marthe to help answer some of these questions.
Okay, so as Amie mentioned, we did sort of group them together, and essentially I am going to sort of send us back to some of the communication that we had provided to you, the registrants, earlier in January, and actually Brittany had one of her slides up there with that In Touch newsletter. So in fact, my recommendation when I get these kinds of questions in, because these do come into us via phone and email. Okay, so what are the rules for returning to work after testing positive for COVID-19? So if you go to that Mini in Touch, and it's actually in the Mini in Touch, but also posted on our website under that COVID-19 information piece, you will find an excellent resource in there that's going to bring you to a link that brings you to the Alberta Health Directives for individuals that test positive for COVID-19, and it kind of lays out the requirements through Alberta Health for that isolation and quarantine. And there's tons of fantastic information in there that will help you, determine these pieces for when you're going to go back to work. And so on to the next one. Do we still need to report to CRDHA if we test positive for COVID-19? So this is an interesting question. Early on in the pandemic, we did communicate to registrants a little bit around reporting, but it was actually, in fact, a volunteer reporting, and we were using that information to help guide us in our guidance documents as we were developing them, and also for some if we were getting inquiries from media. So in fact, we never had a mandatory reporting piece for COVID-19. It was done on a volunteer basis. So next piece, can the college provide information on which COVID restrictions are mandatory and which are recommended to form a standardized approach to care? So again, I'm going to dial it back to that Mini in Touch that was just released. In there, it will take you to some really good links. One of them is going to be the guidance document that the colleges developed together. So it is pretty standardized. It was all of the oral health professions that came together, the colleges, and developed that guideline. So I would reference back to that one. You'll get some really good information out of that. And also there are links to some excellent resources from Alberta Health and Alberta Health Services that will help you with your point of care risk assessment and picking your PPE based on those risk hazards. So I think that's it for those questions. Botox. We get lots of questions about Botox. And so Botox, is it possible to expand our scope of practice and offer neuromodulator services, i.e. Botox fillers, therapeutics, and aesthetic treatment? So actually, if we focus in on the aesthetic treatment right there, it's a good word to look at right now, because when we get these types of questions in, and this is very typical if you're speaking to either, probably anybody, any staff at the CRDHA, we're going to dial right back to the Health Professions Act. This is our umbrella legislation. And so I'll look at that and I'll say, what does that say? And in that legislation, it speaks to assess, diagnose and treat oral health conditions. So if you break it down and you look aesthetic treatment, oral health, assess, treat, diagnose oral health conditions, you can say that's off the table, right? So currently, no, you cannot do this. This would be out of scope of practice. Now we can move on to printed, unless anybody else on the team wants to jump in and add anything. If not, we can probably jump on to printed practice permits.
Yeah, I'll take that one. So as of last year, the college has been providing practice permits online. You can print them directly from the database. So you just log in and you should be able to print your practice permit right from there. You do have the option to print it off and have it displayed as per the Health Professions Act. And the other option in the Health Professions Act is to have it readily available. So you can always pull it up on a device or on your computer screen if someone needed to see your practice permit. But we are no longer mailing practice permits as of last year's renewal, so as of 2020.
I can take the next one.
Salima, can you speak to practice hours while you're still live?
Oh, sure. Yeah. Sorry, I didn't realize we were switching. So the question at the bottom of the screen I'll do first, and then we'll pass it on to Nicole. So there's a question that came in around if someone's unable to complete 600 required practice hours for license renewal because of the pandemic, what options are available? And can you get an extension or special consideration? So we would consider such requests on a case-by-case basis, but that would have to be closer to the time of renewal, so sometime in August. As it stands, all registrants are expected to make their best effort to reach those required 600 hours within their current 3-year reporting period. So if there's a situation that you've experienced some sort of extenuating circumstance that prevented you from working, so if you couldn't have regular employment or you weren't able to temp or that sort of thing, that information would need to be outlined actually in a formal signed letter that's addressed to the registrar requesting an extension. And depending on the number of hours that you're missing and the reasons for that, if an extension is granted, then there may be practice conditions placed on your subsequent permit. It could also be that the registrar refers that matter to the registration committee, which is a group of your peers, for decision. So at the moment, we're not looking at these situations. We are encouraging everyone to really try their best, get those 600 hours in before renewal. You still have a number of months. And if by early August of 2022, you find yourself in a position to not be able to meet those 600 practice hours due to extenuating circumstances and despite your best efforts, please email the college and as a first step, and then we can go from there.
Salima, I just want to add to that really quickly before we move to Nicole. Sorry, Brittany, I'm messing up your live screen. This question is specifically talking about COVID, and I'd just like to remind everybody that there was only a 2-month shutdown in 2022. And so for 2 months, registrants or dental hygienists, dentists, they couldn't work. But that was 2 years ago, and it was for 2 months. And so this 600 hours is not something that we determined at the college. It's actually law, it's legislation. So we really need to, it's going to be really, I would say it's, to be quite honest, it's really difficult to get an extension because you have 3 years to get 600 hours, which isn't a lot, it's 200 a year. And the COVID pandemic should not be preventing you from being able to work in consideration that you're only shut down for 2 months. So Salima said, you know, encourage you to write a formal letter, but I just want to put that in perspective that we are not seeing the inability for dental hygienists to work because of the pandemic. So I just wanted to add that before moving on to Nicole's question.
All right, so I'm answering this question on professional liability insurance. So the question is, I joined both the CDHA and the DHAA and have both malpractice policies. Which policy would be considered first in the case of an incident requiring coverage? Well, the college really just sets the minimum requirements for the professional liability insurance. It is essentially your responsibility to know the details of those policies. So in that circumstance, you'd have to ask your insurance provider to know how to handle that scenario.
Sorry, that's me for the working conditions. Okay, so we get quite a few questions around working conditions. So why isn't the dental hygiene profession unionized? What is the college going to be doing to help with better working conditions for dental hygienists? How can the college work to further improve opportunities for dental hygienists? So just as a reminder, we're set up to protect the public and not to advocate for the profession. And I think that's really, really important. So dental hygiene profession is there, we're self-regulated, there's rules that we need to enforce. But the reason why we do that is to ensure that the public gets the protection that they need. These are really, really good questions for associations. And so anything to do with advocacy, working conditions, employment, essentially benefits for the dental hygienist or for the profession, those are association questions. And so just a reminder that when we do get those questions, we wouldn't be able to necessarily answer them. They're not within our mandate, but they are excellent questions for a provincial or a national association. So those are all the questions that we got sent to us. And so we do have a few in the chat box, and I'm going to read it out loud and then publish it and ask my teammates to help with answering them. So Salima, I'm going to ask you to answer this first one, and I'll read it out loud. As a new registrant in 2020, if our credit period is 2021 to 2024, would CE completed prior to November 21st, 2021 still be accounted for?
Yeah, that's a really common question that we get, particularly right after renewal and from new registrants. So our reporting periods are actually designated based on what's in our dental hygiene profession regulations. So by law, if you've registered after November 1st of a particular year, your reporting period doesn't start until the following November 1st. So if your reporting period is November 1st, 2021, and it goes to October 31st of 2024, only activities that are completed within that 3-year period is what will count. So we have to do that based on the legislation. That doesn't stop you from taking CE credits. It just unfortunately doesn't count towards the credits for that 3-year period. You end up getting a little bit more time to work on your CE and get those credits in.
So the next question we have is someone was wondering if there will be more live events like this one when the changes happen to help keep registrants informed and able to ask questions. So the quick answer is yes. Brittany, maybe you can speak to town halls and office hours and maybe some ideas because of all the changes coming.
Yeah, I think we found a lot of success. If anyone who's on this event tonight attended one of the office hours we did during renewal last year, it was a great way for people to come on and stay on for the whole hour if they wanted sort of more information about how to go through renewal or just ask a quick question to one of our compliance advisors and hop off. So we definitely are planning for more office hours throughout the year. I think when we have those standards of practice consultation, there'll be opportunities for the online engagement. And we always do want feedback from registrants. So we'll be sending out a survey tomorrow that everyone can fill out to let us know what they thought of this event, what kind of events they want in future, because we do always want to hear from registrants throughout the year.
Perfect. So the next question, Marthe, I'm going to ask if you might be able to answer this one. This goes back to the blood pressure, your blood pressure example. So if we can't help answer clinical questions, where's the best location to find these answers?
Yeah, so maybe just if I elaborate a little bit on that, I wouldn't be able to say go ahead and initiate that treatment to that client at that time, but we certainly could help support with appropriate resources. So it's not that we can't help support you as the registrant in locating good resources to make those clinical decisions. It's more that at that time, we wouldn't be able to say, go ahead and initiate treatment. I hope that's helpful.
And then this next question is about whitening. So Marthe, I think this will stick with you because I'm sure you get questions about this. So whitening is aesthetic, but so is Botox. So if dental hygienists can do whitening, why can't they do Botox?
Yeah, I think that, and because of course, when we're doing whitening, it would be for the purpose of oral health, and Botox is utterly out of that purview, right? Aesthetically, you're looking at two entirely different body parts. So it's tougher to get to sort of, I guess, not argue, but to pull Botox into that piece of it. And honestly, you could probably, if you were looking at health benefits for whitening, you would probably be able to come up with some rationale or research that supports sort of emotional well-being for people who whitened their teeth, right? So you could definitely probably pull in those pieces with the whitening.
I think that this is a good example if the dental hygiene profession wants to advocate for Botox, there would have to be a business case put together and a group that would advocate to the government to change our regulations. If the regulations get changed, then we as a college would need to regulate that. So there's a difference between advocacy for increased scope of practice and then regulating that scope of practice. And this is a good example of how an association and a regulatory college can work together, but two separate mandates. And so this goes to the next question we have. If it is not the mandate of the CRDHA to protect dental hygienist working conditions, then who or was it in place to protect the dental hygienist? And that is a very good role for an association. So either a national association, a provincial association, both. I know the CDHA has done some work on workplace harassment, workplace bullying. A couple of years ago, there was a survey and a report done. There's a new dental hygiene association in Alberta. That might be a place to go for working conditions. So those are the bodies that typically advocate and promote and protect the dental hygienists themselves.
Amie, if I could just add to that. For working conditions as well, keep in mind if you're working with other regulated healthcare professionals, there could be some crossover with other regulatory bodies if there's direct concerns about day-to-day operations. So just from a complaint perspective as well, keep that at the back of your heads that there might be a conversation to another regulatory office to have questions or comments about working conditions as well. So I just wanted to provide that as an alternate resource because the governing bodies do look at day-to-day workflow and employees as a condition of the license as well.
Perfect. We did have one question that got published but not answered, and it was around how can I send a question to the compliance advisors. If you don't feel comfortable sending your questions in tonight, then it's easy to contact the college. You can email either Marthe or Nicole at complianceadvisor@crdha.ca, or you can call our office and you can be directed to them. All that information about our contact information is on our website. So we're not getting any more questions, and we're at an hour and 20 minutes. So I think we'll close off for this evening. Thank you very much for attending. Thank you to all my colleagues for helping and presenting. And again, if you have a colleague that couldn't make it tonight, please let them know that this is accessible through our YouTube channel. And if you can fill out the post town hall survey that Brittany will be sending out tomorrow or in the next day or two, that would be really helpful. Again, thank you very much and have a good night.